Hi all, I'm just putting together a quick little video to discuss one of the assessment tasks and one of the common issues that we're finding amongst this. So in Advanced PT Skills Assessment Task 1, Assignment 1, it's related to upper cross and lower cross syndrome, where they basically have to discuss the postural deviations associated with this condition, muscle imbalances and movement limitations. Now in the massage course, there is also an assessment that's similar to this, but it's not exactly the same, but the information will still be fairly relevant. So what we're finding with this is that the upper cross syndrome is being done fairly well, but the lower cross syndrome, when it looks at the postural deviations, a lot of the students are saying that an external rotation through the hips is involved. When we've had a look at it, Justin and I both believe that it's an internal rotation. We've also had this looked at by somebody else who agrees with us. So looking back at a lot of where my students in the past have gotten information from, and I feel that this is the same even with the fitness students, they've gotten this information from Physiopedia. And with my understanding, Physiopedia is very similar to Wikipedia, where it can be edited by pretty much anyone and put the information on there. So if I go down to the characteristics and the clinical presentation of it, basically it goes through saying how the muscle imbalance creates joint dysfunction, joint pain, and specific postural changes such as anterior pelvic tilt, increased lumbar lordosis, lateral lumbar shift, and external rotation of the hip and knee hyperextension. And I agree with all of that except for that external rotation side of things. So then we've gone back, and when I've had a look at the ACE personal trainer manual, which the students all used to get, we go back and it discusses what lower cross syndrome and a study that was done by Vladimir Janda, identifying the coupling relationship between tight hip flexors and the erector spinae. Basically, then this goes through and saying with ankle pronation and accompanying internal femoral rotation, the pelvis may anteriorly tilt to better accommodate the head of the femur. So this side of things and the actual textbook actually supports what we're feeling, that lower cross syndrome does produce an internal rotation. So if any of you actually feel like it is an external rotation, please feel free to either talk to Justin or myself and discuss this further and go through it. We're not necessarily saying that anyone specifically is wrong, but it's more just for you to be aware of where your students may be getting their information from and being able to direct them towards correct sources rather than having them just rely on what they find on the internet. But if we can all just make sure that we're really staying on top of these kind of things, it'll smoothen out the process a little bit more. But like I mentioned before, any questions, please just discuss this with Justin or myself. Thank you.